One type of skin damage is known as a burn, and burns can be caused by heat, but also by radiation, electricity, and chemicals. And a burn just damages skin cells using or caused by one of these different types of elements. So burns can be really dangerous because the integumentary system is not able to function the way that it should. So for example, if you're burned really badly, you're more likely to become dehydrated. And that's because skin has a waterproofing function and that it helps to hold water in your body, and without that protection, the water in your body would evaporate into the external environment. You also lose your ability to prevent infections from getting deeper in the body for the deeper structures because the skin is no longer there to keep it outside. So if you lose skin or if you've got damage to the surface of the skin, it allows things like bacteria and parasites and fungus and viruses to get deeper into the body. It also disrupts your ability to thermoregulate. So thermoregulation just means your ability to increase your body temperature when you're too cold and decrease your body temperature when you're too hot. So when you're too hot, your body typically produces sweat, which helps to remove heat from the body and bring your body temperature back down to normal. But if your skin is burned and the sweat glands are no longer functional, then you're not able to sweat. So if someone is burned, it kind of depends on the severity as to what the treatment is. But if it's bad enough, it may require IV fluids and nutrients and special dressings to keep infection out and stuff like that. So the prognosis of basically prognosis is the outcome. So how likely are you to be able to survive being burned? It's based on two major things. So one is the surface area affected. So that means the amount of the skin that experiences the burn. It also is based on the degree of the severity. So the higher the degree, the more severe the burn is. And these two things go hand in hand. So a third-degree burn in a small part of the body is not as dangerous as a third-degree burn that covers 50% of the body. So let's take a look at some of the different degrees of severity to see what the different degrees mean. So a first-degree burn is a very superficial burn. It only affects the epidermis, which is the outer layer of the skin. It may cause pain and swelling, but it's not very serious and it typically heals on its own within a couple of days. So an example of a first-degree burn would be a mild sunburn. So you can easily recover from it. It's just going to be uncomfortable for a little while. A second-degree burn affects the epidermis and it goes deeper and affects the dermis as well. If you have a burn that results in a blister, that means it's a second-degree burn. So for example, if you burn your finger on the stove and a blister forms, that would be a second-degree burn. Second-degree burns typically will heal on their own after a couple of weeks. It may be painful and it may swell up for a while, and you may need to treat it with something to just kind of help reduce the pain, but overall it will typically resolve on its own. A third-degree burn affects the epidermis and the dermis, and it actually destroys the tissue and the nerve endings. So one interesting thing about third-degree burns is that oftentimes someone who has a third-degree burn reports that it doesn't hurt. And the reason why it doesn't hurt is because the nerve endings for pain have been destroyed. So that's not necessarily a good thing. A third-degree burn does require medical attention. It heals very slowly, and you may need to have a skin graft in order to make the area heal. And so a skin graft is where they take typically skin from a different part of your body and put it over the damaged area to try to establish new skin in that area. Now, if third-degree burns are over too large of a surface area of the body, they can be fatal. and you may not be able to be treated for it. A 4th degree burn is even more severe. It affects the epidermis, the dermis, and it keeps going deeper, and it might actually affect the bone and the muscle underneath your skin. Like a 3rd degree burn, it requires medical attention and requires skin grafts in order to heal. And depending on how much of the body is affected, it can be fatal. So a lower degree is less fatal or less serious. The higher the degree, the more tissue is affected, and the less likely someone is going to be able to recover from the burn.